Uh, I'm coming to you from my office here in Anadarko. I hope you're having a wonderful day. It's Friday morning here at the present time. This is going to be aired, I think, on Sunday morning. These are trying times. We're isolated, and we're just experiencing things that we haven't really been used to. We hope that you're making the best of these times. As I said, I'm speaking to you from my office here at the Physicians Hospital in Anadarko, where I serve as Chief of Staff. And joining me this morning also is Jerrus Harris, who's a certified nurse practitioner who also works in a clinic. And we'll be talking with her a little bit too about her perspective of what's going on. We'd like to speak to you today about the elders, what the elders are thinking about in reopening services at the Southern Oaks building. As you know, Governor Stitt implemented a plan for reopening the economy, which included a phased reopening of the houses of worship. And we would like to share with you our experiences and our perspective as healthcare workers regarding this reopening. I'll tell you a little bit about my day. It starts at 8 in the morning when I get out of my car. I put on my mask and I walk to the checkpoint of the hospital, where someone opens the door for me because the facility is locked down and all of the badge readers don't work anymore, and someone has to let you into the building. I go to the screening area where they take my temperature. They ask if I have any new onset of fever, shortness of breath, cough, any close contact with anybody that's had COVID-19. Ask me if I've traveled anywhere in the past 14 days and where that's been. And if I pass all of those things, they give me a sticker. It's white this morning. And I wear that sticker to show that I've been screened. All the employees are screened. Everyone that works at the hospital is screened every day when they come to work. And they wear masks all day, every day, unless you have a closed one-person office like I have, so I'm lucky enough to have. And so I don't have to wear the mask in the office. So why are we taking these precautions here at the at the hospital? Well, we have a very vulnerable population. We have about 20 patients in a 25-bed hospital. 80% of those patients are 60 years of age and older. It's a vulnerable population with lung disease, heart disease, high blood pressure, diabetes, decreased immunity, other problems. And so they are a very vulnerable population, and we have to protect them. As you know, the nursing homes have had a lot of problems, a lot of deaths in the nursing home. The nursing homes at Norman, Grove, Mangum, Binger have had multiple deaths. The one at Binger, which is a mere 20 miles north of where I work, 27 patients and 15 staff members had the COVID virus. 7 deaths have occurred in that facility because of COVID. Actually, all of the COVID patients in that facility have do not resuscitate orders at this time. And you ask, well, why would they have a do not resuscitate order? Well, by the time you put on all the personal protective equipment that you need to protect yourself, it takes some time to do that. And if a person's stopped breathing or his heart rate it has no pulse, it takes the time before you can get to them to resuscitate them. And the other and it may be too long to take. And the second thing, you're exposing that healthcare worker and staff to close exposure to COVID-19. And so DNR orders or do not resuscitate orders are are present at that facility on all of the patients that have COVID-19. 80% of the deaths from COVID-19 are in people that are over the age of 65. Jerrus, what are you seeing in your clinic? Yeah, go ahead and see what you have to say this morning.
So in my clinic, we have been having an outdoor clinic for the past 5 to 6 weeks. When this whole crisis started, we immediately moved people out of our clinic to promote social distancing instead of gathering. Because social distancing at this point is literally the only thing that we have to protect the public. There are no vaccines. There are no medicines that cure this. COVID is very real. And even though, the governor is lifting these restrictions and opening back up our state in several phases, due to COVID still being in our state and in our communities, social distancing is still a must. Even though we are 5 to 6 weeks from when it really started hitting, our clinic where I currently work, we will continue outside clinic. And when I say outside clinic, there are 3 healthcare workers, a provider, and a couple of nurses. We are fully dressed in PPE. We have stuff over our hair. We have our N95s, face masks, gowns. Sometimes we even have a hazmat suit on whenever we are doing drive-through clinic. So we are seeing anybody who is ill from their vehicles at this point. So healthcare workers are really trying to take steps to prevent the spread of COVID to the population that they're caring for, and relating that to opening churches and businesses, those types of things. Dawn, I think that social distancing is still a must. Everything that you have just mentioned with our elderly population, those are not the only people that are affected by this. People who are immunocompromised, people who have multiple conditions, hypertension, diabetes, multiple things, lupus, RA. Those people are just as affected as the people who are 65 and older. And the thing that is, the most scary about this COVID situation is that, I feel normal, you feel normal. Most people who come to church will feel normal. They will think that, maybe they've got a scratch in their throat. They sneezed a couple of times. They coughed a couple of times in the last couple of days. But they haven't ran a fever. They feel fine. But they're coming to, a church together with multiple people. You never know at this point who actually has COVID and who doesn't. As anything that we have learned as healthcare workers, COVID does not meet the normal, fever, cough, shortness of breath, chest pain. It doesn't meet that all the time. So therefore, people can be walking around and be infected and not know it. Right. I think that reopening things slowly and continuing social distancing is going to be our best fight against COVID and our best case scenario to keep all the members in our church safe and keep the members in our community safe.
I think you're exactly right, Jerrus, and I appreciate your perspective on that. I want to look at what our congregation looks like at Southern Oaks when we're considering whether or not we have a vulnerable population or not, a vulnerable membership. I would estimate that probably 50% of our members are over the age of 60. And who of us does not have a comorbidity? Who doesn't have, pardon me, who doesn't have heart disease or a lung problem or diabetes or high blood pressure or overweight, immunocompromised? I consider myself fairly healthy, but I have 3 of those conditions myself. And another thing that we need to think about also is that another stipulation in this opening up of society and so forth is that there be a declining number of cases in our area over the past 14 days. That's perhaps fairly steady in Caddo County. We have kind of stable at 53 for the past few days. Grady County is increasing from 25 to 31. So that's another consideration. So what would our worship look like if we were to go ahead and institute worship under the present guidelines? For one thing, we'd have worship only. There would be no classes. We'd have to sit in every other pew. Every other pew would be left vacant. Each family member or each family unit would have to separate from another family unit by 6 feet. Masks would be mandatory, so we'd have to put on masks. This includes all the members. This includes the song leader. This includes the preacher. Be wearing masks. And you say, well, that's not very practical. I don't see Ron up there preaching with a mask on. To be that'd be fairly distracting. So what if we didn't wear masks? What would that be? We just go in, we don't wear masks. Well, COVID-19 spreads mainly among people who are in close contact for a prolonged period of time, such as worship service. Spread of COVID-19 happens when an infected person coughs, sneezes, talks, sings, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people that are nearby. And also droplets can be inhaled by the lungs. So masks would have to be used. We couldn't do that. What about the Lord's Supper? If we're passing the emblems for the Lord's Supper, we don't have the individual units that we ordered several weeks ago. They're still on back order, so we don't have the individual units. We can't pass the trays between members due to the virus staying on the surfaces of the trays, and so that's impractical. What about the children? Are they going to be wearing masks? I doubt it. Will they be running around with intermingling with other members? Probably will. I've got an interesting call from Steve McCrae a couple of weeks ago, and it got my attention. At that time, it wasn't very prevalent, and Steve said that at the church where his father and mother go in Lawton, the Northwest congregation, at that time there were 27 cases of COVID in Comanche County. 7 of those cases were at the Northwest Church of Christ. And all of these people evidently had been sitting in fairly close proximity to each other in a worship service a week before everything was closed down, and we had to start practicing social distancing. So 7 of these 27 that were in Comanche County were infected were in that church. Since that, 4 of them went on ventilators. Since that time, 1 has died, and the other one, and 1 more is still in the ICU. Some have recovered. So what we're talking about is not something to be taken trivially. It's not something that say, oh, it's just something somebody else gets. It's not. It's out there in the community. And so there's multiple reasons for our decisions, and we have decided to postpone meeting together on Sunday mornings for the time being. The elders meet weekly by Zoom, and along with texting each other during the week and emails, and we are in contact, and we're constantly evaluating what's going on at the church and whether or not. So we're going to we're going to reconsider this on a weekly basis as far as reopening the church, and we'll just see where things go from where they are right now. And so, Jerrus, do you have anything else further you would like to mention?
No, I think you pretty much covered it. I think social distancing is still a must. And I think the elders at the church are making a great decision continuing to implement social distancing to protect our congregation and our elderly population. And I think that is of utmost importance at this point. I think all the steps are being taken by the elders, and I hope our congregation is very understanding that you guys are only trying to protect them at this point.
Yeah, that's exactly right. Well, we appreciate you, Jerrus, and what you're doing. And we appreciate the members, and hopefully this explains a little bit of our reasoning to delay our opening of the worship service at the building at this time. So, thank you for your time this morning.